county pharmacy, county.
For in terms of diabetes, a lot of things have changed, mostly for the better. But first, we have been talking about diabetes, but we have not understood how bad it is. So diabetes affects about 600 million people worldwide. And in Africa, Africa is one of the sites where diabetes is growing at the most rapid rate.
Diabetes in our country is high. And as our patients talked about really a problem of out of pocket, we know this is really a great problem that is affecting actually people living with NCDs in this country. But as a division, we have our NCD strategy, and one of the pillars is access to medication, which is improving medicines and also other technologies that go with the management of diabetes and hypertension. And it calls upon the counties to really try and support the patients so that they can get their medication where they are. And enhancing this by making sure that the programs that we run in across the country reach to the community, and that the patients don't have to move so far to go and get medication.
Now, my name is Kennedy Odhiambo Roenjo, the Director of Public Health. When Dr. Ogude was talking here, he mentioned the bit on we are not having enough drugs for this. And when I was whispering with the national team lead, she told me that we can always get from KEMSA, and if KEMSA doesn't have, we can also go and get from MEDS. And we are very lucky that we are also joined here by the MEDS, and of course the admin has been sitting in all through. So I think this is just something that needs follow-up, so that we are able to get enough drugs, so that we fall within the theme of this year's World Diabetes Day, enhancing access to diabetic care. Our committal as a county that we are going to make sure that this happens, and of course our patients do not really need to go far and wide to look for these medications if at all we can be able to provide.